bear with me. There we go. The recording has started. So hello and welcome everybody to today. And this is all about how to get into healthcare. And we're with HEE and NHS today. And this is through Thames Valley, Berkshire. My name's Max and I work at Pathway CTM. What do? I'm an outreach manager for Pathway CTM. So I go into schools virtually and I run outreach sessions with students from years 11 to 13 to help them understand what their career options could be, how to get there, how to negotiate interviews, write CVs, think about their strengths and possible career options. And that's why we're here today, to look at careers in the healthcare industry, because there are very, very varied careers and there's a lot of them. So let's try and make sense of it. What I will ask you that today, as we go through this presentation, we will hear from different people and about their roles and what they do day to day. If you have any questions, there is a Q&A box. Please use the Q&A box to put your questions in, because then we can see them and we can answer them either as we go along or when the appropriate time arrives at the end. A lot of information will come through the slides. We will try and answer every question that we get, and it may not be straight away, so be patient. If we have any ad hoc questions that we ask you, we'll put it in the chat box, but that function is there as well if you need it. If you want to, you can try and raise your hand and we can unmute your microphone if you want. I will say though, that doesn't always work, so be prepared that it might not work. And with that, I think we should get started. I did launch a poll at the beginning and it's still up at the moment and you can see it. So a couple of things that we asked. Are you aware of the difference between HEE and NHS? Yes, said 13%, not sure or no was 89%. So guys, hopefully you're going to answer those questions for us. What percentage of healthcare takes place outside of hospitals? There's three options: 17%, 45% or 70%. And 67% of people said 45% of healthcare takes place outside of hospitals. That was the biggest one. So let's see, let's find out as we go along. And then the true or false question. There are over 350 different types of roles you could work in. 100% of you said true. Like I said before, let's find out as we go along. So that's enough about me. Let's hand over to HEE.
Thank you, Max. Max, I can see the poll. Is there any chance of...
I can get rid of it.
That'd be lovely. Thank you very much.
You're more than welcome.
Hi, everyone. My name is Claire Wardle. I'm a Workforce Transformation Programme Manager and I work with Health Education England. So Health Education England is classed as an arm's length body. It is an organisation that supports employers in the NHS to recruit, train and educate staff to make sure they have the right values, the right skills at the right time to care safely for our patients. So that's what health education does, and it's a lot about funding, working with colleges and universities and employers to really support them to get the right staff. So I'm going to be talking to you, next slide please Max, just a few aims of the session. I'm going to be talking to you. You can put all the aims up actually, Max, please, if that's all right. Just keep going. Hopefully I'm going to give you an overview of the different roles in the NHS and a little bit of to increase your understanding about the NHS itself and how it delivers care. Explore some different entry routes into the NHS, some pay and benefit queries have come up. So I think it's just worth looking at how much you're likely to be paid should you come into the NHS. And it's just thinking how big the NHS is. So if you see here, and this is the world's biggest employers. So if you just click Max, you will see it really highlights the UK National Health Service has 1.7 million people working for it. So it's the 5th biggest employer in the world. So really huge. And I'm sure a lot of you on the broadcast today know someone in the NHS. And okay, Mac, you can go forward, thank you. And this is just a simple table just to show some of the places where people work in the health and care sector. Health and care go hand in hand really to deliver care and services to our patients. So as you can see, yes, we're aware that care is delivered in hospitals, but it's also delivered in prisons, in schools, care homes, and overall in the community and in people's homes. So that's just a quick snapshot of where care is delivered. Thank you, Max. So for the poll, around 70% of healthcare is delivered outside of hospitals. And that number, I would say, is really increasing. There's more and more focus on caring for patients in the community and to ensure that there is continuity of care for our patients. Thank you. And to really ensure that patients don't have to travel far and services can be brought to them if necessary. And this can be broken down into a number of ways. So community trusts, they're called. So this is like the local Berkshire Healthcare Trust that may deliver mental health services in the community. GP, district nursing. So that's very focused around community trusts, acute trusts such as the Royal Berks Hospital. So as we know, busy acute hospitals, through charities, independent hospitals, the ambulance trust, through social care. Sorry, Max, can you go back, please?
Certainly can, sorry.
And general practice. So there's a lot more focus now on, going to your GP. There's a lot more nurse advisors, nurse practitioners, physician associates to support the doctors. So you're more likely to see a variety of roles in your general practice. And there's a lot of special clinics they run, and a lot of specialist treatment can be now delivered in GP surgeries. So there's more and more focus on that, particularly for nurses, and when they first newly qualify, go straight into general practice now because it is such a diverse and dynamic area. Thank you. Next slide, please. And just to give you an idea of the typical day in the NHS and how many people visit their GP practice, over 800,000 people in one day, 50,000 visiting accident and emergency, 49,000 outpatients consultations, seeing a variety of different consultants and doctors, nurses, maybe some allied health professionals. 94,000 people admitted to hospital as an emergency, and 36,000 people receiving treatment in hospital for a planned operation or procedure. Thank you. Next one. But it all boils down to making a difference. And I think if you are considering a profession, or your aspiration is to move into health or care, it's all about making a difference to the patient at the end of the day. Everything that we do, the patient should be at the centre of it. That doesn't mean that you will be perhaps giving patient care or face-to-face with the patient. It could be that you're providing another essential service to patients. It is a privileged position. Can you go back, please, Max?
Yep, certainly can.
It's a privileged position to be giving care to patients in some way, and all roles contribute to making patients' experience better. And very often in healthcare, you're not only caring for the patient, but also for the relatives and supporting those as well. The NHS is considered a national treasure, and later on during the presentation, we'll touch on some of the terms and conditions. Thank you. Next one. And this is just to give you a brief overview, really, of the population and what we have to do as healthcare services. The UK has an ageing population, so people are getting older, they're living longer, perhaps with more long-term conditions, and there's less young people. This in turn moves to public health issues. So there's a lot more focus in health now about health promotion, health education, and well-being of individuals. So that we know there's early deaths from cancer and smoking, and a rise in obesity among young adults, diabetes, early deaths from heart disease, strokes, teenage pregnancies, and smoking. And also, during the whole pandemic, there's been a huge focus on mental health and mental well-being as well. So some new roles have emerged from this, so such as the public health practitioner and new apprenticeships to support these health issues that we're faced with. Thank you, Max.
Perfect. Just before we go on, I just want to say, so we've had a couple of those questions that were on the poll already answered, and we can see that the NHS, I mean, it is one of the biggest employers in the world. This starts to give you an idea of how many roles are available. So if you're as a student at the moment and you're thinking about a career in healthcare, what you are hoping, I hope you are seeing, is that the careers there's a lot of them. There's a lot of different roles. It says here over 350 different roles. That is a lot, and there is a lot of opportunity, and there are many different ways of getting into the NHS, and that's what we're going to be picking up on today a little bit later on as we go along as well. So pay attention to the different bits of information and the different bits of research that you guys can do to understand what's good for your career going forward. The other thing as well that I'm battling is, I'm not sure why, but the slides are moving on their own. So do bear with me. When they move forward on their own, I'm moving them back. So I do apologize for that, Claire. But anyway, okay. So let's carry on. So there's over 350 different roles in the NHS.
Yep, and with the next slide, it's absolutely right. It's not just about doctors, nurses and midwives, and I think that's really key. And I know we've got some fantastic healthcare professionals on the line today, but it's just thinking about, it's not just about doctors and nurses. So if you're squeamish, you don't like the sight of blood, or you don't like particularly the thought of talking to patients or relatives, that's absolutely fine. We've got a role, I think, for everybody within the NHS. So thank you, Max. Next slide. And again, just briefly, this is done in 2018, and it's just an approximate number just to give you an idea of how the workforce is broken down. So you can see the 9% of doctors compared to 28% of nurses. We always need more nurses. You know, in terms of healthcare scientists, allied health professions, I know we've got one on the call today. We need managers, we need health informatics and that collection of essential data. So if you're good with numbers, that, you know, there's something for you. You're good with IT, you're good with people, maybe you're good with HR and recruiting more staff and supporting staff in practice. Or actually, if you don't want to be a nurse or a doctor, but you want to be in that support role, there is a role for you, whether that's in operating theatres, on the wards, in the community. So there are a variety of roles. And also, it's important to say, you know, we need the hospitals and the grounds to be functioning, to be well lit, well ventilated. So if you're, you know, interested in engineering or, you know, practical careers like that, we have something for you. So this is just a quick film called Cradle to Grave from Health Education England, just to give you an idea of the number of people involved in different patient care. Thank you, Max.
Bear with me. I think that's my technical issue, which I'm just going to fix quickly. I apologize for this. Not liking that.
It doesn't like it, does it? I'm happy.
No, it doesn't like it.
I mean, it is on YouTube, so.
We'll apologize for that. Okay, well, let's carry on.
Okay, lovely. So should you watch the film, it's a bit of a tearjerker, but I think it really shows all the different careers and potential patients that are seen in different areas and by different healthcare specialists, but it's not just, as I said earlier, not that face-to-face healthcare professional. It's the laboratory staff and someone on the end of a telephone. So there are a variety of healthcare. So let's have a look at some of the career areas that are on offer. And throughout this presentation, I do refer a lot to healthcare careers, and they've got some fantastic resources, website resources. So if we could just go back to that first slide, that'd be brilliant. So health careers have grouped under 15 groups a variety of different careers. So for example, allied health professionals must be 15 different professions within that one umbrella, such as physio, occupational therapy, dietitian. So this is just to show sort of a quick structure. Nursing, for example, we have 4 fields of nursing. But on our next few slides, we can see actually the different nursing specialities that are available. So again, do have a look on the Health Careers website. I'm feeling we're getting out of control here.
Yeah, I think unfortunately there's timings on the slides which are built in automatically into the slide, which takes it one to the other. So
I'll be quick. That's a quick snapshot of allied health professions, but I believe we have one on the line today, so that's fine. So we can move forward. A quick example of ambulance service team and all the different roles within the ambulance service. And that's a YouTube link there that we don't have to watch now necessarily, but there's also on South Central Ambulance Trust, they have got some really good resources on their website about the different routes in, whether it's a 111 call handler or emergency care assistant, and they provide great pathways up towards a paramedic through apprenticeships or traditional training. Thank you. Next slide. And as I mentioned earlier, nursing have 4 fields of nursing: general adult, learning disability, mental health, and children's, which is paediatrics. So as you can see there, there's lots of different ways and areas to work within nursing itself, but also included is research and education. So as you mentioned earlier, you could work in a prison, a school, in theatre, a real variety of areas. You can work in the UK or abroad. So there's lots of opportunities. We always need more nurses, and we're really striving at the moment, Health Education England, to try and meet the government mandate of recruiting 50,000 nurses through a variety of methods. Thank you. This is just a quick idea of all those different roles within the wider healthcare team, whether it's administration, support, domestic services, in corporate services, engineering or finance, estates, so keeping the hospitals and the buildings where we work safe, secure, and working, and the support services as well. Really crucial to make the NHS continue to work. Thank you. And I just wanted to go in briefly about the different ways in. It is quite confusing. There's a lot of information out there. So through apprenticeships is really growing now as a way in into sort of healthcare. A variety of levels through GCSEs ranging to degree level for apprenticeships. Some really great degree level apprenticeships have come out recently. There's a big focus on nursing, allied health professions, clinical engineering, midwifery, biomedical science as well. There's a variety of levels of biomedical science. So you can come in after sort of GCSE level and work your way up to the full degree in biomedical science. For the more traditional routes, such as medicine and dentistry, that's not offered as an apprenticeship at the moment, and you would need to go to an approved university degree programme. You could get a job straight away within the NHS, and it could be in a variety of settings. You could be giving care to patients. You could be working in IT, pharmacy, HR, estates and maintenance. It depends on the skills that you have. Maybe you need particular qualifications, and I can talk about how to get a job through NHS jobs. You could have done a course at a further education college and then want to join the NHS. It'd be after a degree programme that you've done somewhere, and you might want to join one of the NHS graduate schemes, or perhaps experience gained outside the NHS and you want to join. It could be as a second career. Thank you. So apprenticeships, they're a good practical training whilst in a job combined with studying. To be an apprenticeship, it's got to be at least 12 months in length. You will be classed as an employee, you'll be earning a wage and getting paid holiday. You will be working alongside experienced staff. You will be gaining those job-specific skills and getting protected time for training and studying. And on average, it's about a day a week, at least, of protected training to meet the sort of off-the-job hours. Apprenticeships can range, depending on the level, from sort of between 1 and 5 years in length. And they start from the age of 16 or over. And again, some employers will vary what they offer in terms of apprenticeships. So we've got some government websites so you can search for local apprenticeships to you. And it's always worth checking what the entry criteria is for that particular employer and training provider. And they range from GCSE level up to degree and even masters. So pay and benefits in the NHS. Thank you. So pay is structured in what's called Agenda for Change, and you can look this up it's the NHS pay scale. Entry level for a band 2, sort of the first way in, first job perhaps, could be as an administrator or healthcare assistant, and they earn just over 18,000 a year. And within each banding, they may have a number of increments. So after 3 years of training, you will then go up to the next increment. If you then want a much higher salary, you may well then apply for a higher banding, should you have the right training and the qualifications. So I've got the salary for a band 3, so that might be a senior healthcare assistant, a band 4, and band 4 sits with one of these new roles that we have called a nursing associate, and they are a new role that bridges the gap between a healthcare assistant and a registered nurse. You can see what a newly qualified nurse would earn there, nearly 25,000, and that would be a starting salary. And up to sort of band 9, 91,000. And there you're talking maybe a deputy chief nurse, a very, very senior nurse in a sort of a busy acute hospital, just to give you an idea of the different bands. Doctors and dentists and very senior managers on a different pay scale. Thank you. And just some benefits of the NHS. The annual leave is pretty good. You get at least 27 days a year. That increases to 33 days after 10 years of service. On top of that, you will get 8 bank holiday days a year. You can have flexible and different working patterns normally. It could be weekends or nights. There's a cycle to work and car lease scheme that gives you discount or different ways of payment for brand new bikes and cars. And also you can access key worker housing. So there's special opportunities to help you buy. It's a reasonable pension. You can have career breaks if you decided to have a year out to do perhaps a special project or go travelling. And you're provided with study leave as well for a particular training that you would like to do. And you can move around different areas within the NHS and you still have those benefits. You still have your holiday and everything else. And you get good NHS discounts as well. Nando's, New Look, Domino's is always very reasonable, and other retailers, and you have a blue light card. So a lot of places now, particularly with COVID, more and more are supporting NHS and key workers and providing that discount. Next slide.
So I just wanted to say, Claire, so what we're starting to see here is that there are a lot of roles and there's a lot of ways in, and apprenticeships is quite a big way in, obviously, to these roles as well. But with the 350 roles available, I think it's worth mentioning that's 350 roles. That doesn't just mean that you only take on 350 people a year. there's 350 roles, but within each role, there's a certain number of people that are taken on every year. So it starts to give the students that are listening in an understanding of the scale of what opportunities are available there. Don't just look at the 350 and think it's only 350. It is way, way more than that. We saw earlier, the NHS is one of the biggest employers in the world. That's a huge thing. So again, back to the same point, do your research, have a look at what it is that interests you in the healthcare industry, have a look at the avenues that are right for you, and you can see that from GCSE onwards, there are ways in, and you will be supported through those ways in to get to your different levels of career. And like we've seen, apprenticeships can be from 1 year to 5 years, and you can finish an apprenticeship and actually have a degree. It's not an equivalent of, it is a degree within itself, and other qualifications too. So things to think about for students as we go forward. Sorry, Claire, I'll keep an eye on these slides as we go forward. They're keeping me on my toes today, so I do apologize because I know it's not making it easier for you either, but you're doing a great job. So let's have a look, career opportunities.
Yeah, so within that, when you do come into us, there is mentoring. So that's support in your workplace on a day-to-day basis, people checking in with you, keeping you informed. You can ask questions and coaching you through. So you will have questions and you might think, oh my gosh, I really feel out of my depth here. But asking questions to your employer, letting them know that you're not sure or you need some support is absolutely fine. We expect that. We would rather you ask questions than anything happen. There's a chance to shadow, so you can watch other people do their roles or observe or go to another area for a short period of time called a secondment, undertake projects. There is support for professional study and qualifications. It could be through a degree that's related to your career or an apprenticeship. And the NHS also has its own leadership academy at different levels. So there are opportunities for leadership and management development if that's something that you might be interested in. Thank you. Next slide.
Yep, there we go.
So what next? Okay, thank you. And again. Okay, so this one is really about, if you're thinking about applying for a job or preparing for a job or apprenticeship with the NHS or a place on a university course that would have NHS clinical placements, you will need to show how you think the values of the NHS Constitution apply in your everyday work. So these are the NHS values, so working together, everyone counts, improving lives. But it's also worth checking if you're applying to a particular hospital, it's also thinking, what are their values? Have a look on their website, do some sort of research about it. So values, it's really for the employer to think, does this person who's applying to this job, are their values aligned with our values? And they will probably be asking you questions at interview that are related to values in some way. And also it's really good to sort of just prepare for, and there's no right or wrong answers, but when you've been asked about values, so it could be, for example, tell us a time where you have shown someone respect or dignity. And that's for you to have a think about some really good examples. You could have helped a friend in need, helped a neighbour. Someone's told you something and you haven't judged them. You've helped them in a situation where they've been upset maybe, and you can talk about that. So that's a really good example. And when you're writing an application form, you can weave your values through and show some really good examples of how you can make a difference to someone, or how you respect someone, or how with compassion value, how you show that you're kind and thoughtful to others. And that will really sort of demonstrate that you're the right person for the job. So values is something I would say is really important, and to show what your behaviours are. And on sort of thinking about recruitment, it's really being prepared for interview to think of those examples. And as I say, it's weaving it through anything that you write for any applications. Okay, thank you. Yeah, we can flick through these, but these are just some resources from healthcare careers. There's Step Into the NHS, they've relaunched their website now. There's a variety of health careers literature. Thank you. There's a new small pocket-sized book now that's also been released. On the healthcare website, it's accessible by your phone, so you can have a look at different case studies. Okay, thank you. You can register for an account, you can save your searches, and they're renewing their information all the time. Thank you. So it's just to quickly show you. And a really nice one I like, that you can compare 3 roles. I think, is it one more click, Max? Couple of more clicks, so you can compare maybe fairly similar careers, and you might want to compare them to say, oh, what all the training and qualifications are required, what's the expected working hours, what's the expected salary, and then you can really compare. Thank you.
I have to say that that's actually a really good feature, because one of the things that as you look for what your career is in the future, it's very difficult sometimes to compare one to another. To have that feature on there does a lot of the work for you as a student, because then you can start to look at the different pathways or qualifications that you would need, or different areas that you would need to work in, because you need to remember that you need to choose not only what you want to do in the future, but what is right for you and what the right pathway is. So that's a really, really good feature, and I'm glad you've shown us that, because that's really important. That's good. Thank you.
Are we okay for time, Max?
Yeah, we'll be fine for time.
Okay.
We've got a few more minutes.
So I just wanted to show you the NHS job website. You've got the web address there. This is, if you're looking for a job, this is the first place to go, I would suggest. And also you've got maybe your local trust who you wish to apply for. You could look on their website as well. But the NHS job site, you could put in a keyword or job reference. So for example, if you were looking for nursing assistant, you would put nursing assistant and then the location or the postcode where you want to look at. And then it will come up with a variety of jobs. So what I would stress is, when you look at the jobs, always look at the job description and the person specification. And that will tell you clearly what you will be expected to do as part of that role, what the entry criteria is, so what they are asking that you should have before you can apply. And use that information when you're writing your application, because it's all online, you can apply online and it saves it all for you. Read those and make sure that you can match that, and you can say, I do this in this way, and you give those examples. Because very often as an employer, I've read applications and they obviously haven't read the application, the job description. They don't know what they're really applying for. And it's to make sure really that you want that job as well, and you've got a good insight into what it's all about and what you're letting yourself in for as well. And also on the website, in the centre there, you can see advice for job seekers. And that's some really good advice there about values, behaviours, writing an application. So that's a good resource to do. And you can also set up alerts on NHS jobs as well. So if there's any jobs that come up within your parameters or what you would like, you get pinged an email. So it's a really good tool to use to look for jobs. Okay, thank you. I just want to touch briefly on work experience and volunteering. I know it's a really tricky time at the moment for work experience, and I know it's always oversubscribed, and with COVID it is difficult, but there are a lot of trusts at the moment looking to do more virtual work experience, which is really promising. And there are a number of events coming up in the Thames Valley to be considered as work experience. Most organisations run and host work experience and volunteering. So I would just stress, get in touch with the right people and take time to keep in touch, regular contact, maybe send your CV through and a letter and an email, maybe follow it up with a phone call, keeping in touch with them and being persistent really. And think about, well, what do I want to do? If I want to be a doctor or a nurse, can I try working in a care home or being a volunteer somewhere? If you want to be a paramedic, have you thought about St John's Ambulance? And again, it's working alongside people like that. You pick up the values, you pick up some of the skills and attributes that are really needed. And, write those down, add those and save those ready for your application, and think about and do some research around those. And I would say be persistent. The NHS is a huge organisation, we know. As I say, follow up, be friends with the people in the volunteer services department or work experience, being polite and enthusiastic, and they will remember you, I'm sure. And hopefully in time, things will start to get back to normal. in the new year and springtime, but I think there is more and more emphasis now on virtual work experience. So hopefully we can sort of recommence that in a different way, and hopefully have a broader reach out to more people for that as well.
And Claire, with that, I'd just like to say that first of all, those tips that you've put on there are really, really valuable for students in any area that they're looking for, but specifically here, because it gives you a flavour of understanding whether what you think you're going to enjoy, you are actually going to enjoy it or not, because there are a lot of different varied roles, and sometimes you may think you want something, but when you try it, maybe you don't, but it's something slightly different. The point of volunteering is a really strong point, because a lot of jobs aren't advertised, or people get those jobs before they are advertised, because they look at who does volunteer, who has done work experience, who has already given their time. So that is a really good way to get in. And you spoke about virtual work experience, and let me just say that during half term, I think it's the 29th of October from 10 till 3, Pathway CTM will be doing a virtual work experience with the NHS for the Thames Valley Berkshire area specifically. We can send the link in the chat box, but for any of those that are interested in it, come along during half term to that and you will find out more about it. Sorry,
Brilliant.
thank you, carry
No,
on.
that's fine. And I think that day is purely focused on nursing, so that's going to be a really exciting day, that is. And also I was going to just mention, if anyone's particularly interested, say, in mental health or psychology, it's also keeping an eye on those charity websites like Mind, because sometimes they will offer opportunities, volunteering, get involved in some way. So it's just trying to do research and just try and look around what else is around. And I just thought, I think this is one of the last slides, it's just to demonstrate maybe some trends and changes and new roles that are happening. So we know apprenticeships more and more now are being offered by the NHS and social care. More and more places now are offering paramedic science, particularly as an apprenticeship. Psychological wellbeing practitioners. So new roles are being created, especially those to work with children in schools. Increased places at medical school. We've got the NHS Graduate Management Training Scheme, and new roles such as the Physician Associate, who supports the medics, is being developed as well. That's a 2-year postgraduate programme. And degree level apprenticeships I've mentioned the nursing associate role as well, and that's a new role come out in the last couple of years, and now people are able to top up from a nursing associate role to a full nursing degree. So lots of different opportunities coming up, so thank you. And there's just some further information, the NHS job site, the National Apprenticeship Scheme. I would definitely recommend looking at local trust websites, local organisations to you. And Step Into the NHS has got a new and revised website, and Step Into the NHS competition and Health Careers, and the National Careers Service is great for supporting with CVs and applications as well. So thank you, that's from me.
Perfect. Thank you very much for that, Claire. And also thank you very much for battling through the slides there. I hope I did a good enough job, but
really well, thank you, Max.
You nailed it. There's a lot of really useful information in there. We're learning that the NHS is huge, it's varied, it's wide, it's a massive employer. It spends a lot of money and time training, mentoring people, ensuring that they're looked after when they join. So it's not just a case of joining and that's it, you're on your own. A lot of it is you are looked after and you are well positioned to succeed. And careers in the NHS are fantastic. We're going to hear from some of those volunteers now. I'm going to try and keep an eye on these slides and make sure that they behave. I'm not sure I'm going to do a great job. We have put in the chat box the link to that work experience for nursing in the NHS that we're going to be doing in half term for Thames Valley Berkshire. But now we are going to hear from volunteers. And what I would ask you, those of you that are attending, if you've got questions, start to ask them, put them in the Q&A box, because as we go through, we've got different people from different sectors and they'll be able to answer questions specifically or a bit more broadly about the NHS. So think of those questions, get them in the Q&A box, and let's have a look at what you've got for us. So I believe I'm handing over to Ruth, am I? Is that right, Ruth?
Thanks, Jordan. Sorry, Max. Ruth, I have been working in the NHS as a nurse for over 20 years. So actually it's not me that you're going to be hearing from, but I've got some amazing staff here from the Royal Berks Hospital. So apologies for the face mask, but we are socially distanced in the office at work. IT resources are not quite what our ones at home are, so we're sharing our webcam and things. So I've got with me in the office, bear with me, sorry, is Claire, who has done a nursing degree apprenticeship. So she will speak to you guys a little bit more about her own experience. Sorry, Claire's online. I've got Lucy in the office with me, who is a nursing associate. And has also got wide experience in volunteering. And then also we have Sydney Cox, who is one of our newly qualified physiotherapists, but has also kind of come through quite a varied route into that role. And then we've got Anna, who is one of our operating department staff as well. So that's the staff there from the Royal Baths.
Brilliant. Right. Should we get cracking?
Should we start in the office? So Lucy,
let's go for it.
Yeah, I'm going to step away so Lucy can take her face mask off for you all, okay?
Thank you. So Lucy, you're nursing, right?
Yeah, so I've just finished my nursing associate degree, actually on my birthday, so June. But before then, I did a lot of volunteer work, like Claire was saying. So I started when I was 14, volunteered at an elderly daycare centre. And I loved it, so that got my passion for like nursing going. Then I did volunteer work with adults with additional needs, children with additional needs, and then I started working here 9 years ago as a healthcare assistant in major trauma, orthopedics and emergency surgery. So I've got like an urgent care kind of background, and I think in nursing, once you have your speciality, you stick to it. So I love trauma and orthopedics.
Okay, interesting.
Yeah, I don't know, I can't look if there's any questions.
No, I'll let you know if there's any questions. So guys, do start to think about questions coming through. So you can see again there, we talked about it in the session, the volunteering, it's useful, it helps, and it gets you on the right path in. So it's really worth doing. Who else do we have from nursing with us that can speak about nursing?
So I'm Claire and I do the nurse degree apprenticeship course. So I started out as a healthcare assistant and very quickly moved on, and I did a band 4 qualification like Lucy, but I was an assistant practitioner, not a nursing associate. So we're kind of similar, aren't we, Lucy, but then very different at the same time. So I think Lucy can do some medications. I couldn't in my role, and I was specifically trained for one area. So I specialised in ear, nose, throat and eye and head and neck. As soon as I finished that, I went straight onto my nursing. I was very lucky to be offered an apprenticeship route in, which means that I still get paid a wage and all my university fees are paid for as well. So I'm just training for 2 years, which I'm nearly finished now. So just brushing up on all my clinical skills and my experience in lots of different areas. And then I get to choose where I want to work at the end of it and guaranteed a job as a nurse at the hospital as well.
That's brilliant. That's really good to hear. So really good advantages to the routes that you've taken there. And just one question probably for the both of you. You've both said that you kind of specializing or concentrating on one area now. Did you choose that, or did it just happen to be that you had an experience of it in your training and thought, actually I like this one and I'm going to go there? Or was set in your head before you joined?
So I got the job as a healthcare assistant on ENT, and then they've pushed me to go further. I will nurse there for a certain amount of time, but I've actually just finished a placement in A&E, and definitely that's where I'm going to be. Yeah.
Okay.
And yeah, so I just went for my interview. I was very young, what you might call green. I wasn't sure too much about nursing, and I had a lovely sister who worked in the trauma and orthopedics ward interview me, and she offered for me to come and work with her, and I accepted, and then that's where my career started.
Brilliant. I have got a question here as well that's come through, and it does say that if you are applying for a nursing degree, will they take into consideration COVID-19 has made it more difficult to get work experience involving healthcare?
Definitely, but like Claire said, I think there are a lot of options, and being proactive and maybe still contacting people and arranging a placement for after COVID-19 restrictions are lifted would show that, you know, you're willing to do the work.
And
I think as well, like Lucy said, even just contacting someone to ask, even if you get told no, they still actually will remember that you asked, and that looks really good because it shows that you're keen.
Can I ask a question around that as well? When you consider the COVID-19 situation that we're in at the moment and what's happening or what's going on, I know that there's a lot of volunteering opportunities to help on the support services around, not necessarily to do that medical stuff itself, but the support services around it. Is it worth to go and volunteer and put your name forward for those things, because that also shows your willingness to be in the sector?
Yeah, I would. I know we had a lot of porters, didn't we? And we had a lot of people that, you know, were coming and collecting blood samples from the wards and pumps, etc., that they were just helping out. They were just volunteering. But yeah, I definitely go for that.
Perfect.
Sorry, Max, I'd just like to add in there as well. So my team actually helped kind of induct a lot of the volunteers that we had during the early peak of the pandemic. And as the girls have said, it was such a wide variety of tasks that people were doing. And in fact, one of the legacies that we've got is we still have a staff wellbeing centre that is run by volunteers. And what that does is that's extended, just, you know, you think it's so simple, but just making teas and coffees and just being a smiling face to people. And also locally at the school across the road here from the Royal Berks, we had another kind of wellbeing centre where food parcels were being put together for staff that they could order online. And I certainly know loads of people, even ex-nurses who couldn't come back and help, were over the road doing their bit there as well. So everything and anything is very gratefully received, any help that you can offer us.
Yeah, really important information there, because it is about looking at all those different things that you can do to make sure that you get your foot in. All of these things will help, because it shows, with any job that you do, it shows your willingness and character that you actually want to be a part of it, and you're going out there and helping. And I know that in the area that I live in, that we've had down the road from us, the Marines barracks has been turned into a testing centre, and they ask for volunteers to go and test there. Anyway, that's enough about.
And I would also just say, like currently with COVID, the big impact on our volunteer sector, like in most areas, is that actually that workforce are in the over 60s. And therefore, a lot of them have been unable to perform their normal volunteering roles because of restrictions. And therefore, there really are opportunities currently for volunteering. So you've just got to get out there and be tenacious. And keep asking, bring your energy and your smiles.
Absolutely.
Yeah,
exactly. Great advice. So we've got the next bit is about allied health professionals. If my slides stop moving, we'll sit on the right one. Allied health professionals. Am I right in thinking that we've got somebody speaking from allied health professionals? Is that Sydney?
Sydney, yeah.
Hello, yes, can you hear me?
Yes, I can. Yes, we can.
Okay, perfect. So my name's Sydney. I'm a newly qualified physiotherapist. My sort of journey started off in 2015. So I did my first year at A-levels and passed all of my exams, but sort of just decided that to reach my full potential, I felt that I needed to do something more practically. So I decided to do an apprenticeship at the Royal Berkshire Hospital as a physiotherapy assistant. So unfortunately back then we didn't have the apprenticeships like we do now, but I did that as, it was an advanced apprenticeship as a physiotherapy assistant. That was for a year and I enjoyed it and loved it so much that I decided to get a job as a physiotherapy assistant, but in another trust, because I thought it was quite important to see the varied sort of things in different hospitals and the way that different hospitals work. So I worked at the John Radcliffe in Oxford for a year. Whilst I was working, I did my access to higher education, which was an online course as I was working full time. So I did that alongside working as a physio assistant. Once I completed that, I then applied for the undergraduate physiotherapy degree at Coventry University. So I always knew that I wanted to go to Coventry because I knew that the students that they produced were amazing and I wanted to be like them when I was a physio assistant. So I decided to apply there and luckily enough I got offered a place, purely I think based on majority of my experience as well in the hospital. A lot of the questions when you do interview for uni courses are about your experience, so I felt that the experience that I had was, you know, put me sort of in good stead to get a space on the course. I then come back here to work during COVID as a physiotherapy assistant on intensive care, and from that got offered a band 5 physio job. So I'm now working as a fully qualified physiotherapist. I've already done my first rotation and I'm now on to my second rotation.
Fantastic. That's brilliant. That's good to hear another story about a different way in and how to get there. And Sydney, hold tight because I'm sure there's going to be some questions coming your way.
Okay.
We're gonna move on to the next volunteers, and we've got here theatre staff. Now, correct me if I'm wrong. This is nothing to do with the arts, right? So who have we got?
Oh, hi there, it's me, Anna. So I'm a newly qualified operating department practitioner. So I started in December last year. So my journey, I've always been in, doing healthcare works. And I came to this country joining healthcare assistants, work in a different environment in healthcare. So I decided then to enter the operating theatre because I saw my nan had a very good experience in operating room, and I thought, oh, I could be one of them, the people who actually give life-changing, life-changing moment to my nan. So my nan inspired me to kind of go to that path instead of like sitting in the office and kind of not knowing, where will I go after this? And yeah, I'm very hands-on in terms of looking after people. So I thought, why not? So I'm 30 something years old, and I thought, oh, it might be too late for me to kind of go on to the new role, but it didn't kind of prevent me. In spite of my age, I kind of just go on. So I studied for 2 years, and I think now, because operating department practitioner is becoming a degree, so it's actually 3 years now. But then it's worth it. It's a very rewarding role. So to kind of look at the pathway of the patient in the theatre, it's a significant role, I think, to kind of embark on, to kind of ensuring, in a brief moment that you're checking in the patient, and then gaining trust would be a bit, hard, but for you to be there and kind of reassuring them and making the environment safe for them all throughout the journey, the operating journey is making me happy. Every time I go to work, I kind of say to myself, yeah, this is where I belong. And I know that I'm helping quite a lot of people, ensuring that the operating procedure will go as smooth as possible. So yeah.
Fantastic. And it's good to hear that there's so obviously we spoke about the fact that you can join as early as 16, but then also there's somebody who's joined a little bit later in life who's decided to change career and make a move forward. So those options are open to you, and that degree, this applies to degrees as well, but apprenticeships too, that you can start them at any age. You can start an apprenticeship at 16, but you can be 60, 65 to start an apprenticeship. Same with university. So those avenues are open, and they are there and they do exist. Okay, we have got a few more questions coming through, and I want to leave a couple of minutes at the end to go through those because we've got some good ones. Let's hear from the last set of volunteers, which is about non-clinical staff. Is that Hannah by
I think that's me. Hello.
Hi, Hannah.
So yes, I'm non-clinical staff. I work for the communications team at Royal Berkshire Hospital. So my role is very varied day to day, but that's what I love about it. And it's slightly unique in that I'm split across, I do communications for the Royal Berkshire Hospital, and I also do communications for the Royal Berks charity, who fundraise and support the work of the hospital. So I'm normally seen running between 2 offices and a bit hectic, but so I look after the communications for both of those. So that means social media, design work, making videos, updating websites, doing branding, and all kinds of press and media. But what's great about it is that I get to support so many other teams in the organisation. So I get a lot of insight into other teams, both clinical and non-clinical, which otherwise I don't think you would get. So NHS comms is a really fast-paced environment to be a part of. But what's great about it is actually communications, the career of communications. You get so many transferable skills that can be used across any kind of industry. I didn't start off looking for NHS work, but that's where I ended up. And I'm really glad that I did. So if I just talk a little bit about how I got here, I started in the NHS in March of this year, so the week that the country went into lockdown, which was great timing. So I've learned a lot and very quickly, which has been great. I don't ever really remember making a conscious choice to choose communications as a career, but looking back, it does kind of make sense how I got here. So I always enjoyed writing and was very good at writing, and that kind of carried me through school and college. And after college, I went to university and I got a degree in journalism. Soon found out that journalism isn't quite as glamorous as you might think at the beginning. So I had a change in direction and went to work for a comedy PR company in London. And then from there, I fell into the third sector. So I was working for a charity and worked there for 5 years. And that's where I really learned what communications was and how it can be applied to lots of different industries. But what I loved about working in the charity was working for a purpose and working with people. And that is what motivated me to then work within the NHS. So I worked in the charity for 5 years, kind of achieved everything that I could. And then after spending a little bit of time in hospital with my family members, I thought to myself, oh, actually, I think I can make a real difference if I apply my skills into this new and exciting world. So I started looking for NHS jobs then, and here I am.
Perfect. So this is a really great thing to see as well, because Claire spoke about it at the beginning, that not every career in the NHS involves blood and guts. So if you are of a variety, listen, the NHS is huge. This is what I'm learning from this presentation. You have to think that an organization like the NHS doesn't just rely on doctors and nurses, but there are people behind in the background that need to run the services to make sure that nurses and doctors can concentrate on being nurses and doctors and not doing the other stuff. So there is so much opportunity within the NHS. It's not just about the healthcare side, it is about the non-clinical side. We've heard it today about the communications, about fundraising, because there are many different things that go on, many different things that have to happen, and it costs money for the NHS too. So with that, and actually we have got some questions that have come through, and I know that Claire would like to answer one of them. So I'm going to hand over to you, Claire. And the question is, I would like to become a nurse in the future, however, in the military. And is it completely a different route to approach, or is it the same? So Claire, can you let us know, please?
Yeah, I was just going to say, it's always worth looking on the specialist website, so the Army website, the RAF, and I would suggest, because I've done the same with my daughter, suggest making an appointment with their sort of careers advisor, going along, meeting them, or having a chat on the phone about all the different routes. Because again, you might think nursing and they might say, well, have you thought about this profession? And they're the best ones to guide and advise you on the entry criteria. It's more than likely to be 5 GCSEs. But very often, being in the military, they will also support your training, so you don't have those fees at university. It might well be that they stipulate that the training is, for example, run at Birmingham City University, but then you don't have the student debt when you come out. So it's worth going directly to those military organisations, whether it's RAF, Army, Navy, and speaking direct. So I think that would be a really helpful point, and they could guide and advise you on applications, what to include, and those extra things, those extracurricular things that will perhaps give you a few bonus points and add strength to your application.
With that, actually, I would like to mention that I did a similar broadcast a few weeks ago with the RAF, and this is something that they spoke about because they offer a lot of apprenticeships in the RAF, and there's also apprenticeships in the military as well, not just apprenticeships, other ways in too. And they did speak about the fact that there are people who would like to join the military side, but as a nurse or working on the medical side, and you would go to them to talk about it, and they, like Claire said, they will help you with the training. If you want to learn more about that, yeah, go and visit the RAF website or the military websites, but also have a look at the Pathway CTM YouTube channel, because there should be a webinar on there that we did with the RAF that does talk about this area as well. So like today, we've had the NHS and HEE people come and talk about healthcare and the ways in. They did the same for students there. So have a look at those. We have had a couple of other questions as well, and I want to read out the answers so that we've got them for those that aren't on live, but they will see the recording later on. And one of the question was that, do you have to be a certain age to volunteer in a hospital? The reply is that in Alison's hospital, you would need to be 17 years old to volunteer. Is that across the NHS? Is that in a hospital? Is there other settings in the healthcare industry where you could volunteer at a younger age? I don't know who would like to answer that, but can anybody shed some light?
I would suggest that in the non-clinical areas, they may well consider taking people younger, but it depends on the trust policy. And each employer may be different.
Perfect. Okay. And again, goes back to that point. Have a look at where it is that you would want to do it. Get in touch and ask that question. Don't let it be a barrier. Go forward and ask the question, because you might not be at the right age to do it now, but you've already asked the question. They may remember you when you go back 6 months later to ask again. Now I'm at the right age. Can I do the volunteering again? These are all the bits that will help you and will put you in good stead. Okay. Let's have a look at a couple of other questions.
Sorry. We've just got a little bit to add on the volunteering and the age limit.
I started volunteer work when I was 14 at an elderly daycare centre. I worked with adults with additional needs at a daycare centre and children with additional needs in a special unit attached to a hospital, like a respite unit. So you can definitely volunteer. I think most places they have to do, is it a DBS check? Like make sure you don't have a criminal record. And then if you get good references, say from like your teachers, or if you're at college or anything, then you can start younger. But I mean, that was over 10 years ago, but I'm not sure if it's changed, but I definitely started young.
You've lined me up quite nicely there, because somebody else did ask about the question that it says that to volunteer, that in the application process includes obtaining satisfactory references, 2 of them, health clearance, and a disclosure and barring service, a DBS check. And does this mean you need them to volunteer? And if so, how do you get these? The reply that we have got is that to apply to volunteer, like you just mentioned, if you are successful, you would be sent an occupational health form to complete and a DBS form to complete by the HR department. That's the non-clinical side. That would then do the check for you to make sure that you can get in. I mean, I can mention my own personal experience as we start to wrap up. That my wife recently, well, she's been redundant for over a year, and she recently signed up to become to work at a plasma donor centre for the NHS, and she is just getting her paperwork through now. She has to go through the DBS check. She will be trained, and that's not just volunteering. She will be paid to do it, even though she doesn't have the relevant medical experience, but what she can do is relevant and is going to be used. So there is other pathways into the NHS. This is what we're learning. There's so many roles, there's so many ways in, and there's so many things that are available. I've put in the chat box a little form for those that have attended to fill out, to understand how we can help you better make decisions for your future, and to let us know what you thought about this session. It is 3 minutes over, so I am going to have to bring the session to a close. But I would like to say thank you to all of you that have come along today to give your time to volunteer in what is already a busy time of year, to come and give your advice to those people that are looking to make it their career of the future and the next generation that go in. Claire, I would like to thank, especially at the beginning, because I apologize for the slides and me having to control them, and I think you did brilliantly well to cope with it, and it was great. So I apologize for that, but you did a fantastic job. So thank you to everybody from the NHS, and thank you to all of those that have attended with all the questions that we've had, and it's been great having you here. Remember, this recording is available later, so if you want to watch it back or use it in a classroom, go for it. And thanks very much, everybody.